Research conducted by the Road Traffic Management Corporation in collaboration with the South African Medical Research Council and the University of South Africa shows that driver alcohol intoxication accounts for 27.1% of fatal crashes. The figure is considerably higher than the current estimates and is projected to cost the economy 18.2 billion rand annually. The report also shows that 55% of fatal crashes occur at night and about 3 out of 5 happen over the weekends. The corporation has called on officials to increase operations against drunk driving. Anesh Sukhai from the South African Medical Research joins us now to unpack the study and its recommendations. Anesh, a pleasure to have you on the program.
Thank you very much. Good evening to you and good evening to the viewers as well. Yes, sure. In terms of the results, I think it's important just in terms of context that this study wasn't designed specifically to measure the burden of alcohol with road traffic injuries. It was one of the findings, but the actual focus was looking at the relative contribution of alcohol intoxication versus other driver behaviors, and this being important really to inform interventions that are targeting driver behavior. So in terms of the why I say it is limited, we say it's 27.1% and 18.2 billion, but really we are looking at just the cases that involve driver error. We are in the process of refining these estimates to look at all road users, looking at all causes of road traffic crashes, and looking at not just fatalities, looking at all core of all injury severities as well.
Let's just expand on the findings of this particular research. It shows that driver alcohol intoxication accounts for 27.1% of the fatal crashes in the country, a figure which is considered higher than the current estimates. How much does driver alcohol intoxication account for fatal crashes in the country, and what is its impact overall and the cost of it really?
Right. In terms of the impact, so we know from various studies that have been undertaken in the country, there but data looking at burden of disease. Alcohol plays a huge role in not just injuries, but across the board a range of diseases. Looking at injuries, it's about 40% of violence, and there's been some really conservative estimates around 14% attributed to alcohol. That's attributed to alcohol. So this has been varying. We've got this estimate of 27.1%, and as I've indicated, that it's a work in progress, and we're going to be refining this estimate to provide a more comprehensive picture of the burden of alcohol and road safety in the country. And I think in terms of the impact, as you asked, I think it's really made us appreciate, and it's really, the pandemic has given us this opportunity to appreciate the burden, the true burden of alcohol and alcohol-related driving. And in terms of in terms of the impact, it is really staggering, and there's a lot of work that needs to be done in this area.
As we mentioned in the opening, it's been said that this study was conducted through a collaboration of several institutions. Just take us through how the study was conducted.
Right. So with the study, we are looking at national data, and we're looking at data over a 3-year period from 2016 to 2018. This data is being collected by the RTMC as well as the Department of Transport. And thanks to the Road Traffic Management Corporation for funding this work and appreciating the importance of evidence-based strategies, I think the RTMC is really looking at ways in terms of us taking this data to provide evidence in terms of the next steps in terms of addressing driver behavior. So it was these 3 organizations, and the brief really at this stage was looking at the relative contribution of alcohol. And just to pick up on some of the key findings, I think, a lot of it is what we know has emerged from the sector over the many years. But I think really this is starting to provide genuine, robust evidence that allows us to quantify effects, and also looking at effects in a disaggregated way. So looking at the relative contribution of different behaviors by different road factors, by different road safety, road traffic outcomes, and that gives us specific areas for intervention. So these are really important. So just looking broadly, like for example, we know, for example, most road traffic deaths occur over weekends, over nights, but some of these interesting findings, for example, the role of long weekends, looking at a relatively higher risk during non-vacation periods versus vacation periods. And really, this is starting to give a clearer picture in terms of where our resources need to go. For example, with addressing alcohol, it really needs to be during these times, nights, over weekends, and non-vacation periods. And for example, addressing speed-related factors, it would be during other times of the year.
Let's zoom in a bit more into this. Why is it so important to look at the role of the drunk driver and the risks that they pose?
Right. So in terms of accident causation or the causes of road traffic crashes, I mean, as you would know and the viewers would know, that it's really multifaceted. It's a combination of driver behavior, the road environment, looking at enforcement, and so forth. In terms of specifically with alcohol and speed are generally regarded as the largest contributors of driver behavior to road traffic crashes. I mean, that's undisputed from global research as well as research locally. So really it is an opportunity to address such an issue. I mean, at the same time, we know there's a lot of currency, there's lots of discussion and policy movement along the lines of addressing alcohol limits and zero tolerance policies. And I think with this work and new work that we are beginning with, this would be important to inform such discussions in terms of these policy decisions.
But how does this research help us look at the impact of drunk driving as a whole, especially when we went through an entire pandemic which revealed the immense disruption of drunk driving that it causes on hospitals and trauma wards?
Correct, yes. So as I've indicated, that this study really has set out to, with a specific purpose, looking at the contribution of driver behavior, specifically alcohol intoxication in relation to other areas. But this has importantly started to give us evidence, quantifiable evidence in terms of the effects across a range of factors and a range of different outcomes. And this allows us, at least in the road safety sector, to start with concrete interventions. I think the different sectors really would start looking, and now that we are starting to appreciate the role of alcohol, trying to find opportunities. And really, these depend on evidence-based strategies for implementation.
And if you can just indulge me a bit as we chat more about some of the key findings of the study, what are the crash and vehicle characteristics?
Right. So I've mentioned about the temporal factors in terms of when these occurs, the time of day, weekends, vacation, non-vacation period. I think that was one of the big findings. The other one, in terms of the vehicle-related factors, I think one of the concerns and from this research is the looking at the relatively higher risk for alcohol-related deaths with public transport vehicles. And these being both minibus taxis as well as buses. And clearly, in terms of our interventions, for example, roadblocks or whatever stops and searches and so forth, whatever enforcement strategies are in place, really we need to start targeting vehicles that are showing greater risk, and these tied with the different times when they display these greater risks as well.
Yeah.
And besides these two areas, the other area being the estimation, I think that's really important, and it's providing opportunities for us in terms of refining the system with the RTMC in terms of the way data risk factors are documented, where alcohol should be recorded independent of other factors. So we can start looking at the role of alcohol together with, for example, speeding and other high-risk behaviors as well.
And as we wrap up, just take us through some of the key recommendations. I have to push you, unfortunately, for the sake of time.
Sure. So as I've indicated, I mean, this does study designed to look at driver behavior. So enforcement is a big part of it. So I've indicated enforcement and when this needs to happen and targeting specific vehicles. But more broadly, in terms of addressing alcohol, I mean, I spoke of the zero tolerance limit. But at the same time, whilst this is an important strategy, we really want to emphasize that it's important that a broad, integrated, comprehensive strategy is adopted, where other really important areas like, for example, passive prevention of, for example, pedestrian injuries, infrastructural upgrades and so forth are given priority. And importantly, also looking at us as a country adopting global practices. I think importantly, we know that the Decade of Action strategy 2011 to 2020 didn't work into our second decade of action. And really, we need to start looking at novel ways of addressing road safety.